Hello and welcome to another edition of Insight, the Greater Cleveland Partnership feature that focuses upon areas of importance to the Greater Cleveland business community. I'm Steve Leutner, and joining me today is Alicia Washington, Senior Director of Government Advocacy for the Greater Cleveland Partnership. Hi, Alicia.
Hi, Steve.
Alicia, today you and I are going to be talking about a topic that has significance not only in Cleveland and Cuyahoga County, but all over Ohio, and that's the so-called extension of Medicaid benefits.
That's right.
What exactly is it? How did it come to be in Ohio?
Right. So in late 2013, Governor Kasich asked the controlling board to authorize the state to accept federal funds that would extend Medicaid benefits to Ohioans. The board voted to do just that. So starting at the beginning of this year, January 1st, we've been able to accept the federal funds that will allow us to extend benefits through the end of this current state budget cycle, which ends on June 30th of 2015.
So this extends coverage to somebody who, or a family that is at 138% of the federal poverty level, which translates into what in terms of an annual salary? Or
Right.
income, rather?
Right. So that's about $32,500 for a family of four.
A year.
Yes.
How many folks in Ohio have enrolled in this or signed up for this since it came to be?
Right. So based on what we're seeing, about roughly 400,000 Ohioans have coverage now that did not before because of the extension of Medicaid benefits, and that's a little more than 50,000 in Cuyahoga County.
Now, the Greater Cleveland Partnership has supported, they've been a proponent of this. Why is that?
Well, we see it from a number of different angles. We have a lot of hospitals that are within our membership, and we understand their concerns when they talk about the skyrocketing uncompensated care costs that they're seeing for individuals that are coming to the hospital, that are coming into emergency rooms, that need service, need care, but they don't have health insurance. And that's a cost that gets passed on, whether it's through higher insurance premiums that employers have to pass on to employees, or the overall community impact that has to taxpayers.
Now, this is right now it's in effect in Ohio, but this is going to expire in 2015 at this point.
Right. I mean, based on the authority of the controlling board, they were only able to authorize the state to accept the federal funds to extend the benefits through the end of this current state budget cycle, which ends on June 30th of next year. So in order to continue the extension of Medicaid beyond that point, we're going to need legislature approval to do that.
They're going to have to reauthorize.
They're going to have to reauthorize this, right? And we're going to see that play itself out beginning at the start of next year. You know, Governor Kasich is expected to put out his budget early February of 2015, and then the House and then eventually the Senate have to go through a process to evaluate the budget, approve it, and Medicaid extension will be a part of that debate and discussion.
And this will just be a continuation of what exists right now. It won't be an expansion of it. It'll just be a continuation of what exists now.
Continuation of the current eligibility standards that we have, thanks to the extension or expansion that happened.
And so this is going to be a big issue in Ohio next year.
Very much so.
You're going to be watching it very closely for the Greater Cleveland Partnership.
That's right.
Thanks, Alicia.
Thank you.
And thanks for watching another edition of Insight. In the weeks and months to come, we'll be examining more issues of importance to the Northeast Ohio business community.